Hello, and thank you for volunteering to advocate on behalf of podiatric medicine and surgery, and for joining me for this brief presentation of the talking points to be used in your visits with congressional offices during next week's virtual APMA Advocacy Day. My name is Ben Wallner, and I'm the Director of Legislative Advocacy and APMA PAC, and I'm going to talk you through presenting this information. There's a bit to cover, so let's get to it. During your visit, we are asking that you discuss these 4 topic areas. I'm going to go through the points we want you to make for each one, recognizing that the flow of your individual meetings will dictate just how much of this information you will be able to cover. It is perfectly acceptable to cover the highlights and not get too far into the weeds, as we recommend that you send our packets of information with your thank you emails as a follow-up to your meetings, so that can be how you ensure that you cover everything. And as always, feel free to defer any questions back to me and your lobbying team at APMA for follow-up. One more note, for each one of the issues that we will be discussing today, we really do want to stress the importance of double-checking the co-sponsor status, which is posted to the website, for each one of these bills. If your legislator is already signed on as a co-sponsor of the bill that we're having you talk about, the only thing we want you to do is to thank that office for their co-sponsorship support and then move on to the next issue. It's always a good idea to bookend your meetings with a message of thanks. You can start and end your meetings on a positive note by taking a moment to offer thanks. Open the meeting by saying thank you for making yourself available to meet with you. Thank them for their efforts to stabilize Medicare reimbursements for 2023. Thank them for their willingness to intervene on behalf of the physician community when proposed regulations create unnecessary barriers to delivering care to patients. And be sure to tell them that the podiatric medical and surgical community looks forward to working with Congress to create workable solutions to healthcare issues as and even before they arise. The first priority issue that we'll be covering is the HELP Act, reintroduced in the U.S. House by Congresswoman Diana DeGette from Colorado and Congressman Bill Johnson from Ohio on behalf of themselves and a few other original co-sponsors in the U.S. House, and by Senator Debbie Stabenow of Michigan and Senator Todd Young of Indiana in the U.S. Senate. There are 3 parts to this bill that need to be explained. The first part recognizes DPMs as physicians under Medicaid. The second part clarifies paperwork requirements under the Medicare Therapeutic Shoe Program for patients with diabetes. And the third part is how we pay for it all. One of the first things that we recommend that you do after thanking the office for your virtual visit is to express the reasons why we think Congress needs to pass this bill. Start off by explaining that podiatrists are considered quote-unquote optional providers under Medicaid, despite the fact that the services provided by DPMs are the same medical and surgical services that can be provided by MDs and DOs. Be sure to touch on your education and training here and highlight the similarities between DPM and MD education. For example, we do 4 years of undergrad with a focus in the biomedical sciences, 4 years of podiatric medical school, and we finish up with 3 years of hospital-based surgical residency training. Another reason to pass the bill is the diabetes epidemic in this country, which continues to be out of control. We need to stress to policymakers that patient access to care provided by podiatric physicians and surgeons will keep America walking, going to work, and paying taxes. Pull out that old saying, save a limb, save a life, save healthcare dollars. Highlight for the office the fact that the bill has been around since 2004 and faces no opposition from any medical society or interest group. Make sure that they're aware that we have bipartisan sponsorship and bipartisan support from the members of the major committees of jurisdiction over the last 20 years. This legislation is low-hanging fruit for Congress to show voters that they can work together to get common sense solutions done. The first and most important section of the bill is the beginning, which changes the way that you are identified under Medicaid. You've been recognized as a physician under Medicare since the mid-1960s, but Medicaid has continued to list you as an optional service provider since you were written into the program back in the early 70s. It's important to point out that the profession today is vastly different from what it was back then. Residencies weren't required, and if you got one, it wasn't likely to be in a hospital setting. as opposed to today when every DPM student is required to complete a 3-year hospital-based surgical residency where they train shoulder to shoulder with their MD and DO counterparts, and they do the same rotations with very few exceptions. Also important to point out is the fact that only 3 states currently exclude podiatrists from participating in Medicaid: Alaska, Alabama, and Kansas. Every other state already includes podiatrists, so the impact of the legislation will be extremely limited to these 3 states. The rest of the country will see no change in how Medicaid programs function, with the exception that state legislatures will no longer be able to cut us out as providers. Most states currently use a managed care model, so access to specialty providers is already limited, and that won't change, and states will retain that flexibility to manage their own programs. A key point is that foot and ankle medical and surgical services are a mandated covered benefit. It's the provider of that benefit that our bill aims to amend to include DPMs as eligible. Our bill does not mandate that patients have to see a podiatrist. It simply adds choice for the beneficiary. Second part of the bill modifies the Medicare Therapeutic Shoe Program to clarify paperwork requirements. The current program allows patients to see a podiatrist or orthopedist for lower extremity problems. Important to note is that this problem affects DPMs and orthopedics alike. It is not unique to DPMs, but it is a problem with the program itself. If a Medicare patient with diabetes receives a prescription for shoes or orthotics, before that prescription can be filled, the patient has to schedule another visit to their PCP or endocrinologist, whoever manages their diabetes, and that provider has to take the prescription and sign off on the medical necessity. Only then is the patient permitted to get the prescription filled, and only then will the provider be reimbursed for the service. The problem, as we all know, is that physicians aren't accustomed to having to assume liability for another physician's work. This reluctance results in patients being unable to get their prescriptions filled, and every day those patients continue to walk in ill-fitting shoes is another day they're at risk of complications from their diabetes, whether it's ulcers and ultimately amputation. The last section of the bill is how we pay for it. Congress always wants to make sure that bills are paid for, so our bill uses an unimplemented recommendation made by the Government Accounting Office, GAO, back in 2011. Under the current Medicare program, providers who owe back taxes will have their Medicare reimbursements garnished until the debt is paid in full. No such program exists under Medicaid, so the recommendation from GAO was to create one. According to the GAO, implementing this program for the 7,000 tax-delinquent Medicaid providers in just 3 states, Florida, New York, and Texas, would have collected up to $330 million in 1 year, which is more than enough revenue to cover the estimated cost of our bill. The primary obstacle to passage that we face isn't from organized medicine. It's because of the Congressional Budget Office's estimate for how much the bill will cost. This estimate is referred to as a score. The last time our bill was scored, it was part of the legislation to eliminate the SGR and replace it with MACRA and MIPS, which was more than 10 years ago. And there are major problems. As stated, the bill was scored more than 10 years ago, just after passage of the Affordable Care Act, also known as Obamacare. Obamacare was originally intended to expand eligibility access under Medicaid, but that provision has since been struck down by the Supreme Court, and only a handful of states actually expanded access, whereas the vast majority of states left the status quo. The Congressional Budget Office, or CBO, strangely assumed that the provision regarding the therapeutic shoe program for persons with diabetes was intended as language to add podiatrists to the list of eligible providers who can participate. As we know, podiatric physicians have been participating in the shoe program since its inception. So we have added language to the bill known as a rule of construction, which explicitly states that the bill doesn't expand the program. Lastly, when the bill was last scored, the number of states who weren't covering services provided by podiatrists under their state Medicaid program was higher than what it is today, more than double, in fact. Most notable from this list are the states of California and New York. Now that they are covering services provided by DPMs means that they're already budgeted. All of these combined will result, we believe, in a significant reduction in the cost estimate, or score, for this bill. But in order for CBO to review the bill, we have to get more co-sponsors and move the bill. The ask for this portion of the meeting is to sign on as a co-sponsor. Direct the House offices to contact Connor Murphy and Congressman Bill Johnson's office, and direct Senate offices to contact Amy Brown in Senator Debbie Stabenow's office. The next bill we'll be discussing is the Strengthening Medicare for Patients and Providers Act. This bill will stabilize Medicare reimbursements by tying the fee schedule to the Medicare Economic Index. We want to request that Congress end the ongoing uncertainty around physician reimbursements by establishing, at a minimum, an annual inflationary update to the fee schedule, which is exactly what this bill will do. While costs of running medical practices have gone up by 47%, physician payments have declined 26% from 2001 to 2023 when adjusted for inflation, making it difficult for small, rural, and low-income serving practices to stay operational. In recent years, many nonpartisan government stakeholders have repeatedly expressed concerns about the failure of Medicare payments to keep pace with the rising costs of running a medical practice and the damaging impact it can have on patient access to care. The Medicare trustees and MedPAC have called for legislative action to address the Medicare physician payment system by providing physicians with an annual inflation-based update tied to the Medicare Economic Index. A March 2023 report from the Medicare trustees states that the trustees, quote, expect access to Medicare participating physicians to become a significant issue in the long term, unquote, unless Congress takes steps to bolster the payment system. The next bill we're asking you to highlight during your meeting is the Affordable Insulin Now Act. You may recall that last year Congress passed legislation requiring Medicare to provide a 30-day supply of insulin for $35. The Affordable Insulin Now Act would cap out-of-pocket costs of insulin products at $35 per month for people with private health plans and Medicare Part D plans, including Medicare Advantage drug plans. For commercial plans, this applies to one of each dosage form, whether vial, pump, or inhaler, of each different insulin type, whether it's rapid-acting, short-acting, intermediate-acting, long-acting, ultra-long-acting, or pre-mixed. For Medicare plans, this applies to all covered insulin products and copays are capped at $35 for all preferred and non-preferred products included on plan formularies. The last bill we ask you to highlight is known as the READY Act, which stands for the Resident Education Deferred Interest Act. Physicians in residency receive very low compensation and are often unable to begin repaying student loan debt immediately. Although these residents can qualify to have their payments halted during residency through deferment or forbearance processes, the loans continue to accrue interest that accumulates to the overall loan balance. Enactment of the READY Act would prevent medical and dental residents from being penalized during residency and save them thousands of dollars in interest. Providing interest accrual relief during residency would also make the concepts of opening practices in underserved areas or entering faculty or research more attractive and affordable to residents. We want you to end the meeting on the same high note that you started. Thank them for the meeting, thank them for their time, thank them for their service, thank them for considering your requests, and then be sure to reiterate them. In particular, the first one is the highest priority for us. After you've finished with your visits, we're asking all participants to please tell us about your experience. It's really easy to log your interaction on our e-advocacy website, which will record your notes directly in our database. These notes are key for us to know who we need to speak to in follow-up to your visits, and they also let me know when I schedule a meeting with your legislators how receptive that office is to our requests, and it can let me know if there are any problems I need to be aware of before going into a meeting. It only takes you a few minutes to tell me about your experience, so please remember to log your interaction on e-advocacy. Before we conclude, I want to remind everyone that APMA credits its legislative and regulatory success at the federal level to years of relationship building as a result of strong membership support of our Political Action Committee. The economic impact of the pandemic has been extremely hard on the PAC. Our donations are still significantly down from pre-pandemic years. If you are able, we would sincerely appreciate your support. You can find our PAC donation page by scanning the QR code image on your screen right now, or by visiting us at www.apma.org/donate. Thank you again for your advocacy on behalf of podiatric medicine and surgery. If you have any questions about any of the materials covered here, please reach out to me. Thanks again.